Hello, I want to welcome everybody to this very exciting event that we're having this evening. We are going to be debuting EMFACE TMJ, and really how EMFACE plays such a crucial role both in my business, but then also how it really plays into the entire dental world and solving a need and a problem that's affecting so many people's lives. I am blessed to be able to share this webinar with some of the best minds in dentistry that I have met. And I know Dr. Chandra very, very well. We also have Dr. Jonathan Levine, amazing history in this space, very diverse, has a background, everything from a professor to private practice, started multiple businesses. So his site and how he looks at this space is unique. We have Dr. Joe Wade, amazing background as well, and a nice combination of the aesthetic side as well as the dentistry, and Dr. Chandra, a friend of mine and an amazing background in a lot of the functional dentistry as well as TMJ specialists and air passageway. So we're going to be diving into this entire conversation, really get into what is TMJ. How is this treatment really changing the game for what we can offer to patients, but also having this platform in our business? What can this provide on the business aspect? Because in our clinic, I'm Nick Tverdick. My wife and I, we started ARIA Integrative Health almost 15 years ago. Now we've treated 17,000 patients. Functional integrative regenerative medicine clinic first and foremost. We just happen to do the entire aesthetic and med spa side at the same time. And EMFACE we've had since it first came out, and I'm so excited to be able to offer the TMJ, and we've seen incredible results in the patients that we've treated so far. So we're going to dive in and really get into how this can affect not only your patient care, but also your business at the same time. So we're going to dive in, and we're really going to understand some of the growing demand for the solutions that we're going to talk about today. Also, how do we integrate EMFACE functional TMJ into the practice to drive more revenue? Because this space has been constraining on the entire medical industry, insurance, et cetera, et cetera. How can we kind of break some of those chains and integrate a treatment that is really a game changer in patient care, but also the ability to grow the practice to get more into cash base, and then also exploring some of the aesthetic side of what we're going to be doing. So the first person that I'm going to call on, and an amazing brain, is Dr. Chandra. And Dr. Chandra, could you really dive into what is TMD, right? Because you've been doing this for quite a while in this space. So when we get to really what are we talking about, the underlying root problem, would you please describe this?
Sure. So I'm glad to be here. Thank you. And what a great esteemed colleagues that I'm joining today. So let's talk about what TMD, and let's first talk about what TMJ is. So TMJ is our joints that is attached to our skull and attached to our jawbone, which is also attached to a lot of muscles and tendons and ligaments. And it has a nice disc in place, like a cushion, that is supposed to help us chew and function. So when we talk about the word TMD, which is temporomandibular joint disorder, TMD, it's actually a condition that affects all this TMJ jaw joint, jaw muscles, and related structures. And this can cause a lot of pain and limited movement, range of motion when we're talking, chewing, just doing our everyday function. It's can be quite painful if it has a lot of dysfunction to it.
Okay, so in just everyday side of what's happening with patients, what are some of the challenges that these patients are seeing, Dr. Chandra?
So a lot of times when our jaw muscles get fatigued from clenching, grinding, stress, just overusing our face muscles from talking a lot, people can actually get headaches and jaw pain, ear pain, stiffness and movement from their muscles, sometimes even like ringing in the ears. It's can be very uncomfortable because we use our teeth and our jaw muscles every day to talk, chew, eat, speak, even breathing and yawning. It's almost like it's repetitive motion. Like even as I'm talking now, that jaw joint is going and it's attached to all these ligaments, like almost 10,000 moments a day. So it gets a big workout. Our jaw joint does.
Yeah, it's amazing when something that's so standard and just part of life in general, when somebody doesn't have TMD, and I'm blessed to say I don't have that problem, but I know multiple people that do. And when your entire day can be affected by something that's so simple that not everybody fully understands, it's amazing when we can bring something in-house to actually help with that. Yeah. So is TMD growing? Are we seeing more effects of this as we go along?
Well, I sure am in my practice. I live in practice in Frisco, Texas, and we have a very large community of professional working adults, and the stress level these days seems to be, beyond measure. There's a lot of our patients who also are not only doing that, but are raising their children and have teenagers and children and all of their activities, and they're very, very busy. And so we're just seeing a lot of people having something to kind of be stressed about. And so the clenching is just a very normal and natural thing with a lot of our clients. On top of that, so many people either working from home and working on computers now on a daily basis. And these little things that we now have in our hands all the time, so many of us are seeing so much more screen time that we actually have a name for it now. It's called tech neck. And, if I didn't know better, I would think they were all in dentistry because we've had tech neck for many years, right, guys? Leaning over and looking down. This is not a healthy thing for our patients. And so, yes, I'm definitely seeing an increase in bruxism, stress, anxiety. This is also adding to more misaligned teeth and bite issues, chipping and breaking of the teeth. And oddly enough, we're also having a much softer diet in general as a preservative type of situation. Our foods are not as natural as they used to be. When they were more natural, they were actually harder. And so now this lowering the chewing demand that we all have is actually making this whole problem more prevalent.
Yeah.
That's fascinating how the just everyday function. And Dr. Levine, I would love to hear your take on this as well. And then also, what do you see on some of the potential of where this space is?
Yeah. Well, I really agree with Jill. What she's saying is that there's this increase in hyperactivity of these muscles. We have two offices now. The Uptown office, we've been together for about 35 years. It's multi-specialty where we have prosthodontists, restorative dentists, perio, ortho, and the technicians all under one roof. So we do take a very collaborative approach to these kind of problems that they're multifactorial in nature. If you unpack it and really looking for root cause, which we do as doctors, and really try to figure out the why behind it before you go after the therapeutics, there's a number of reasons. And Jill, outlined it and showed it, Dr. Chandra, with what we're seeing, which is hyperactivity of muscles. So you start getting into this TMD situations, these elevator muscles, the masseter, the internal pterygoids, the lateral pterygoids. But, it's very interesting. It wasn't until we opened up the downtown office where we started giving, and Nick, I think you're going to relate to this, stress release massages as part of the introduction to what we're doing, because it's multi-specialty and we're looking to connect much of what we do, dentistry and medicine. We started realizing, I would almost say it's 70, 80, 90% of the people had hyperactivity of these muscles, whether it was the sternocleidomastoid, whether it was, the masseters and the deep masseters and temporalis. And so with this hyperactivity of muscles, the integration of a therapeutic is fantastic, but the ability to unpack it and really say what was root cause, really started to allow us to understand the importance of some things that we didn't really understand up until the last 7, 8, 10 years. And that is sleep. And that is the inability to get into deep restorative sleep, whether the person is either a nasal breather or a mouth breather. And if you're not breathing through the nose and you're not getting that nitric oxide, and if you're not allowing the body to get into this deep reparative sleep, you are clenching your teeth. And the prevailing thinking is that we clench and grind as a neuromuscular activity to move the jaw somewhat forward, but to get the tongue forward, that opens the airway. Almost it's autonomic type motion. And so there's some very new thinking, because in the old days, we remember how it was always an occlusal trigger, a bite trigger. And today we realize, yes, that's possible, but there's all these other things that are happening, because, the mouth is part of the human body. And the fact that dentistry and medicine is disconnected, it's really, you got to go way back to understand why that happens. But sleep and grinding and clenching is starting to bring the disciplines of dentistry and medicine together. So if we look at it, the short answer is yes, we're diagnosing better, we understand more, we can unpack and really look at root causes. And then by having some of these new tools, like an EMFACE TMJ protocols, we can really start healing as we take this therapeutic approach, but we're doing a number of things together to really help our patients.
Yeah, and I think it's important for everybody to understand and expand a little bit on what everybody says. Like this is a major problem that we've just started to understand fully in just the last 10, 15 years. And having something to really address this problem and change the status quo of the treatment process that's come before, because the results have been okay, but haven't been fully complete. And where we're seeing this come in. So Dr. Chandra, could you please walk us through what is the standard protocol of a patient if they're experiencing these problems?
It's in protocol who they see.
Yes. So what is the process? Yeah. So how does it typically start? Somebody starts having
a
some
problem.
jaw pain, some
So what happens is a lot of people have this clenching, grinding. They just don't know where to begin. So a lot of times it's natural. They just don't know that the headache comes from, it could be a teeth disorder, bite disorder. And I'm going to piggyback of Dr. Levine. There's a lot of sleep issues out there, which I see primarily in my practice, where a lot of the patients that don't sleep well have a lot of TMD disorder. But having said that, patients don't know where to begin. So they do go to their primaries initially. And when you see a primary physician, internist, family practice, they tend to see that, yes, you're having a tension headache or you're having facial pain and what have you. They don't really know how to treat that disorder. They don't connect that. It could be stress related from the jaw bite or the posture and things like that. So basically, there's a lot of initial diagnosis with just giving medications. And that's the frustrating part. You just get a muscle relaxant and they call it a day. But still, patients are having a lot of discomforts and they don't know where to go from there. And I see so many, because I'm primarily a TMD, sleep apnea, heavy rehabilitation dentistry practice, that they've said that they've gone to the doctor, got the medication. Then they've said they've gone to the ENT because they don't know why their ears hurt, or they have pressure in their ears, or why they have vertigo, or even tinnitus in their ears. So the ENT looks at it and they'll say, well, you're clear for, sinuses, you don't have any ear problems. Then I've seen more ENTs refer and say, go see a doctor that does TMJ. It could be your jaw joints. And that's when the dentist or any kind of orthodontist gets the hand of it. And that's just kind of a process that I'm seeing. Mm-hmm. And some dentists, honestly, we're all trained in dental school to know about the jaw and the teeth and the alignment and all of that. But a lot of it's out of their comfort zone as a general dentist. Mm-hmm. And sometimes they will make a standard bite guard that is actually fabricated in a dental laboratory setting. And it's just very random. It's almost like you go to the store and you can purchase one. It can either hurt you or it can make it worse or it can make it better. There's this whole window of people that can make it better if you just get a little spacer between your teeth and your face muscles will be good. But there's still a root cause to this issue because people don't know how to wear those, how to wear it regularly. And then there's some dentists that are very highly trained, like the colleagues that we have on board here. We have a special education in that. We may be able to go further and help them with the right type of orthotic appliance or using modern technology to see what facial muscles. In my practice, what I do is I have a lot of EMGs and CBCTs, and we know kind of exactly if it's a joint disease problem or if it's a muscle problem. At the end of the day, you're trying to get help from a dentist, and then other people may just go to a chiropractor, or we refer them to chiropractors, or we refer them to physical therapists to relieve that tension. It's a very slow way of doing it. There's definitely necessary and necessity for these professions, but unfortunately, it's not going to improve it so much. Again, we're not getting down to the root cause of it. And sometimes it's referred to the oral surgeon, which is basically surgery. Very, very aggressive situation or a solution for something that we can back up everything and deal with the root cause, which is muscle discomfort, right? So this is why I'm excited that technology like EMFACE has come around. And believe me, I'm a big technology junkie. I've used lasers, I've used TENS units, I've used a lot of different things. I'm very, very happy to add something to our modality.
That's exciting. So it sounds like, so the process has been pretty standard for a
long time.
Just functional issues that people have, whether it be knee pain, things like that. You go primary care, then a specialist, then all of this, and then go down the surgery route or chiropractic manipulations, things like that. So
yeah,
the opportunity, because of what Dr. Levine was saying and what Dr. Wade as well as Dr. Chandra were saying, I mean, this is an enormous opportunity on the business side for where we can go. So I just wanted everybody to really see the opportunity of what we're seeing in this industry, but then also we see with the patient flow and where they have gone. What are the current treatment options that you're seeing patients go through?
I mean, I can help start that. I mean,
yes, and Dr. Wade, please interject as well.
Yeah, so again, I use technology to help get to that derived end result. We call them orthotics. Like a foot would have an orthotic to balance out the body. An arm would have an orthotic. We make mouth splints that are orthotics. They're not all equally made. So therefore, sometimes they're called splints and night guards or store-bought situations. But basically, it's just ending with one approach. What else is next after that? I mean, I'm a doctor that does do what's next, but what is in between? Some people can't do these type of appliances due to expense or time or whatever it is. So what is the in-between phases of helping people out? Of course, there's traditional routes of muscle relaxants like we meant. People get a little addicted to muscle relaxants. They don't get that solution. It's drugs after all, right? Then, you have lasers, which it's wonderful technology. It reduces a lot of inflammation today. Again, it's still not kind of providing a long-term solution, but it helps. TENS units are there. A lot of doctors use neuromodulators. I'll let Dr. Wade talk about it. Of course, surgery is there. These are just some of the modalities that we use today. It's very typical. Dr. Wade, I'll let you chime in on that.
Absolutely. When we're talking about neuromodulators, I mean, Botox is probably the most common one that you're going to hear patients talk about. They're not going to ask for a neuromodulator. They're going to ask for Botox, or do you do Botox? And I'll be honest with you guys, it's still part of my toolbox that I use for, possible, if it's appropriate, for some TMJ patients. We've got some development of some of these larger masseter muscles that literally when I ask them to bite down so that I can see what muscle is actually the most affected right now. And if you can actually literally see their face, like push out and push in when they bite and clench their teeth together, we've got some major muscular, things going on. But also you can see it in their temporalis sometimes too. And so these are great uses to maybe at the beginning get some change, some multiple changes once while you're trying to get them comfortable. Because really, it could be multiple things. I agree with this list is great, and just like you were saying, it may not be just one thing is the answer.
So
Right.
when we're seeing these current treatment options, there's obviously, if people are still in such pain, which is what you're all sharing with me, and we see it in our clinic as well, where do you really see the gap in TMD care as being, Dr. Wade?
I personally see the gap in the diagnosis part of it. To be really honest with you, I have many people who've been to multiple dentists even before they get to me because they've been searching for someone to be able to get some help. And I'm still very surprised at how many of our dental professionals are still having trouble equilibrating a bite, actually having their occlusion be right. And if somebody's had any recent dental work, like even a singular crown in the very back within the last year or so, and didn't have the TMJ issues before that, my first go-to is articulating paper and a handpiece and go back there and adjust and equilibrate a bite. I also feel like a lot of people are missing the fact that if I see somebody come into the office, and I'm at the office, so I'm pointing at the front door. That's kind of strange. But if I see somebody coming through the front door and they have like a boot or a knee brace on, my first thought process is, hey, is that just about to become some TMJ issues for that patient? Because the body kind of sitting properly like an Eiffel Tower can be really strong and straight. And basically those chiropractors can keep them all straight up and down, right? But as soon as something really low happens that takes things off course, then the right knee can turn into the left hip, and the left hip can turn into the right L4, L5, and then the left shoulder. And then the next thing you know, they have a really serious TMJ inflamed like problem. But that's when they come to the doctor because it hurts, because it's in their head and they can't stop thinking about it. So I think for me, the biggest gap is actually the diagnosis of what is the root cause of the TMJ problem. Because if you can be sure that you didn't miss that, then you actually can help the patient. Because again, you might need to be saying it's time to go to the chiropractor. It is time for that muscle relaxant, or it is time for that neuromodulator treatment right now. And now we have this amazing tool, which I can't wait to get to, of instantaneous relief for a lot of people. So I'm excited. That's at least what I'm finding in my office.
No, and that's what we're seeing in our office too. And our entire business is really built on energy-based devices, as well as the full functional outlook looking on. So how can we really maximize a patient's care with whatever it might be, whether we treated actually a D1 athlete today with M-Scope Neo. He had a stinger on Saturday, and he was supposed to sit out until he couldn't even feel his thumb. And we did one treatment, started the re-education process, and he had full feeling in his thumb and things like that. But we're looking at the functional base of what's happening with patients. And when somebody would come in with TMD in the past in our clinic, I would immediately refer out to a dentist that I know does a lot of mouth guard work. We do also some injections, some neuromodulator injections in the past. But I'm a big believer, if we can get to the root cause and actually treat the foundation and a lot of the mobility of what's happening, especially in the joint, which we haven't been able to do before, that's really bridging the gap. That's the missing link, because we can freeze the muscle, but that's just a piece of the pie. Are we going to keep doing it in certain cases? Of course, right? Or if somebody has a terrible bite, is the dentist that we work with obviously going to work on the functional piece of that? Of course. However, now being able to actually re-educate the entire neuromuscular system and hit the joint space in a novel way, I get really excited about it, because we've been extremely successful with EMFACE on the aesthetic side, My passion, I know I've spoke with you numerous times, Dr. Chandra, but my passion is when I can get people out of walkers, or I can get people out of pain, non-surgically, non-invasively, and bring function back to the patient. That's what's so exciting, because we're actually addressing the facial muscles and the soft tissue simultaneously on hitting the joint space uniquely. But I'm also a big believer in the business side of things, where if you're a dentist and you can invest in a piece of technology, but then also gets you into an entirely different world on the aesthetic side, you're having two different pieces of technology all in one on the aesthetic as well as the functional side. But we're dealing with two different technologies in the device itself, which is radio frequency heat and high fez. So it's truly an amazing treatment that we've seen so far. And I personally believe this has been really the missing link to all the treatment processes that we've seen before. So I want to go over some of the regulatory stuff that we've seen. Let's get a little deeper dive. So Dr. Chandra, could you dive into what we're seeing? Because this is the full functional TMJ solution to TMD and TMJ. What we're seeing in our clinic is truly amazing. But if you could dive into some of the backgrounds of what the FDA clearance is and how you were part of it.
Yay. Yes, finally we can talk about it. So just early this year in October, we got the FDA clearance, BTL did, for the EMFACE device. Of course, we've always had the aesthetic device, but now we have this, which is basically a controller and a single-use applicator. And it is simply designed to relieve symptoms associated with muscle spasms and the TMJ dysfunction and the associated pain. So it's there to muscle re-educate and help with that increased blood flow, which is the RF technology, and maintain that mandibular range of motion, basically the jaw moving left and right and opening more. Already, and also in Health Canada license, because we have some Canadians possibly on board. EMFACE is used for the EMFACE cheek single applicator. It's again also intended to relieve these symptoms with muscle spasms, TMJ, TMD dysfunction and pain, and supports that muscle re-education and increases that blood flow and helps with range of motion. So how it's used is we are using high fez technology, which we're all very familiar with, high intensity facial electrical stimulation. It's low frequency high fez technology, and it stimulates the muscles with tiny little facial contractions on, tiny little electrical impulses. Sorry, I was going to go with the EMFACE aesthetic for a second. Sorry, guys. But this is for the electrical stimulation and using that synchronized radio frequency, which is the warmth against the tissue. It's a monopolar radio frequency heating. So it's completely specifically targeted to help with the nerve that stimulates the muscles of mastication, which is the masseter we keep talking about, the anterior temporalis and the lateral and medial pterygoid muscles. So the difference between the aesthetic and the TMJ functional, I'm going to go back a little bit, please. The difference between the TMJ is the frequency. The frequency is much lower, which is going to relax the muscles instead of toning the muscles with the aesthetics, right? So it relaxes the muscles while the RF is increasing that blood flow and helping with the relief of those muscles. It's the low frequency that's actually getting deeper to that nerve tract that is innervating those muscles. There's a big difference. So thanks for pointing that out, Nick.
Yeah, no, absolutely. And here's explaining some of that ultra low frequency high fez.
Correct.
So please continue on that.
So just pointing out again, as we know, facial anatomy, there's a lot of anatomy that controls. There's actually over almost 25, 26 different little muscles that help us to chew and eat, to be specific. But these are the largest group muscles, which is the masseter again, which is our cheek ones, and our head one, which is complete the one here. Dr. Wade had pointed out, sometimes you can see that bulge out. If you had people with no hair, you could see them bulge out. That's because when our teeth clamp together, that is our elevator muscle that is actually working. And that nerve that stimulates that muscle is going to feel a lot of discomfort when we clench and grind and have that tension. So this is specifically targeting those muscles, and the internal lateral pterygoid is phenomenal because even a basic TENS unit can't get down that deep sometimes, even with the frequency. We do our best with it, but this machine is completely getting down into it. But the best part is it's helping reduce that joint stiffness and supporting that smooth jaw movement. This is definitely here for the range of motion that we're all looking for to help our patients out with the HIFES technology. And of course, you've got, I believe, the synchronized radio frequency that's also there. That's going to help with the improved blood flow and the stimulation and relaxation. And it's going to work together with this HIFES technology. And because it's such a large applicator, it's going to cover a lot of that surface area a lot better with the uniform heating. A lot of times we have TENS units that are very tiny. They do not cover as much as this amazing pad does. And the direction of how the pad is inserted is also going to help get the masseter muscle. Again, and that temperature that we have is going to, and here's a great picture of how it's laid out vertically, top to bottom, versus the aesthetic, of course, which is more angled sideways to get those aesthetic ones. So this is going up and down, and it is also the lower frequency, and it's going to send pulse feeling rather than a contraction feeling.
I think that's a really good way of putting it, because anybody that's felt EMFACE for the aesthetics is definitely a super maximal muscle contraction feeling. But with this, much more pulse rate. I like the way that you describe this.
Yes.
And this specifically, the FDA clearance, this is actually for dentists, what it is FDA cleared for. This is fitting directly into the dental practices, because now you have a tool that fits in. That clearance is pretty exciting. And this is one of the pilot studies that done on this. And Dr. Levine, you were part of this, and I've spoken with a couple of the people in here.
Yes. So yes, this was the original pilot study that was done, and Dr. Levine was, and I was part of it, and along with a lot of esteemed colleagues around the country. And we were the basic nutshell of this test was we were going to see these patients, and we were not to guide them with any kind of appliances or exercise or modalities other than just seeing them for the testing. So we were checking for range of motion and if they were able to open more and what their feedback was. So we definitely got about 91% of positive feedback from all these people's reaction to how well it helped relieve some of that symptoms. 95% of these people were able to move their jaw left and right. Some people would just walk in with very limited range of motion. I need people to understand when you have TMD, it is so painful sometimes that when you can't move your jaw just to eat basic things or open it up to even yawn, there's so much discomfort. It's like your knee or your elbow. If you can't move those, it's that painful. You can see in this picture clearly when we were measuring this person's opening on the very far left, it was so much strain in her face to try to open that wide. Just let us see how much measurement. Normally a person should open about 50 to 55 millimeters on just normal, like a 3-finger test. If you can get your 4 fingers in there, this person couldn't even get 2. But as a progress of the whole study, after 4th treatment, she was opening with ease in the second picture. Again, a month later, we were asked to see them. Again, no modalities, no bite guard, nothing. These people are saying that, hey, I still feel great. I'm still able to open. And even up to 3 months, they are still opening wider than they walked in, and they're feeling a lot more comfortable. Great result from this, knowing that we could help people. But the good news is we dentists will still have a job. We still need to help them with guards and such, but we want to get our patients out of pain.
Well, and that's really, I'm going to talk on 2 things here. That picture is amazing. She looks like she's in excruciating pain.
Right.
And then just 4 weeks later, There's no grimace whatsoever. Now, I don't know if you used any neuromodulators on their glabella, but I'm just kidding.
Yeah.
But that looks substantially more comfortable just to open
Yeah.
our mouth, which is a normal part of life.
Yeah.
Normal part of life. And we do have a video.
I've been suffering for years. I mean, 20 more years with TMJ. And you are the one person that has given me some relief. And this new technology, I've been delighted to participate in. It's not painful. It's very relaxing in my case. I think actually I could have fallen asleep. I was so relaxed. And in the first session, I could feel a difference and looked forward to the following 3 sessions. I've done 4. And truly, it's a difference of night and day in how I feel. Going from, just being always in pain to open my mouth, yawn, and I'm not doing that anymore. Life has gotten more comfortable.
It's so powerful.
Yeah, I was pretty excited about her situation. They've suffered quite a bit long term. And I was happy that we were able to do it. And she was part of my studies in the beginning. Pretty exciting.
And how long has it been since she has done that?
Now we're going on 6 months and I still see her. And she goes, that's great. Because there is some benefit to the EMFACE, of course. It's going to help relax. And of course, we've gotten her in an orthotic sense and she's much better with that. I don't do a lot of neuromodulators because of some of the side effects long term. Not saying that there's anything wrong with it because it's a great emergent way of helping. But with her, it was great to see her relax with it. But I told her, you know what, let's just keep this going. And she's actually the one, because would you mind if I do it all by myself? Because you could have some follow-up, or you could do EMFACE again, or make it a regular part of my practice, which we'll talk about later. I said, sure. She goes, I just love the way it makes me feel. It's almost like a massage to them, right? And I said, you go, come on in, we'll do it for you. So it's kind of cool to see that.
That's awesome.
Yeah.
And integrating something like this into the practice it's interesting for some dentists because a lot of people have never done this before. But it's such a normal transition in conversation that at least we like to teach. We do a lot of business consulting. We work with a lot of different dentists, and especially dentists that have been heavily on the insurance-based side of things. They want to get to the cash base, and having something that's a natural progression in terms of a solution for what so many of your patients are having. That's what gets me excited, because when you can integrate something into a practice that doesn't involve you hunched over and using your hands, that's a beautiful thing for everybody that is watching.
Yeah.
If you can make money and have a procedure work without you in somebody's mouth, that's a very, very powerful piece to this entire this entire world. And my passion's in functional medicine and in the wellness industry. And I would love for Dr. Wade and Dr. Levine to kind of dive into the wellness approach to dentistry and how EMFACE, TMD, TMJ fits into this whole space, because this is what people are looking for now.
Yeah. I'm happy to jump in first. So, the question you're asking is poignant. It really is, because we live in a sickness model. 20% of our GDP is spent on healthcare. That's about $4 or $5 trillion. We spend $1 billion a day on cardiovascular disease, 147 billion a year on diabetes. I could keep going, but these systemic inflammatory diseases are killing our economy, but killing our people. And so the whole concept that we all deeply believe in is that how do we get people focused more on a wellness approach? In other words, go upstream before people develop these systemic inflammatory diseases. And that's why, technology is helping us in dentistry because we're oral physicians, we think dentists, we think these negative words, but the truth is we're mouth's connected to the rest of the body.
Absolutely.
And as we all know, and if we can go into a wellness approach, in other words, in our dental office, we can diagnose things that can make people healthier. TMJ, MPD, muscular dysfunction, neuromuscular problems, sleep problems, microbiome issues, nasal obstructions, all these things we diagnose today because of our new technology, CBCTs, salivary diagnostics, all these great tools. So diagnosis, we're all talking about it, is key. And these type of tools and our new knowledge is allowing dentistry to work more collaboratively with our medical doctors. The medical doctors are critically important, as far as sleep tests and to collaborate with us on that. And, for us, we can see things and we say dentistry is the tip of the spear to help prevent chronic inflammatory disease, because you go to the dentist more, you go to your primary care physician. Right. So that's kind of the basis for us. And here's a new tool, this EMFACE, and this is, a TMJ protocol that is so early right now. It's, 6-7 months in. But what we're seeing is these amazing results in treating this neuromuscular issues. And, if it's something that is predictable, which it is, and something that we can improve our patient outcomes,
Yeah.
This will be solidified in the profession for sure.
Nice. And Dr. Wade, could you dive in? You mentioned it a little bit earlier. Dr. Levine, I love the way you look at the whole person holistically in your practice. That's what we all need to do. Dr. Wade, can you kind of talk about how the TMD links the body as a whole? I'd really appreciate that, and how this can be the end result, because that's fascinating to me, and I'm sure for a lot of people on this call that aren't necessarily down on the wellness model but want to be, because like what Dr. Levine said, insurance pays for illness, not wellness, and what patients really want is to get to the wellness side of things. So if you could please chime in.
Well, I'm going to take it from the wellness approach, or kind of transforming from traditional dentistry into the wellness approach. And it really happens in our hygiene rooms. This is where we get to see them more often than any physicians. We spend more time with them. And you have an opportunity as a dental professional to create some massive loyalty with your patients to keep coming back to you year after year after year. And from a business standpoint, to stop thinking about tooth by tooth and start thinking of that person as, what is their 20-year value of staying with you? And by you kind of incorporating wellness into your practice, and stop having people look at you as a drill and bill and fill 'em kind of person that they could just go right down the road for $100 better value of a filling, versus never them wanting to step out of your practice, because you are now part of their integral, trusted, valued partners, partnering with them in not just their mouth, but their whole health and well-being. Yeah. Like, you will have patients that will stay with you forever. And that's the opportunity I hope that people see when we're talking about going from dentistry to wellness. You now have tons of things to talk about. There's pretty much nothing off the table that you can either talk to or influence with them, right? These are huge opportunities.
Yeah, and that's interesting. So to expand a little bit upon that, so you have the model where you have these patients that are already trusting of you, and when you have a patient that's trusting, walk us through really how are you choosing the right patient in that space for what we're doing. In particular, you have somebody coming in. They came in because they came in for a cavity or whatever it is, their bite, and they're like, what does the patient journey look like when you're in identifying them?
Well, I think we've touched on quite a few of them. The first thing I could say is just pay attention, like look at your patients and see what's really going on with them. Did they the last time that you saw them in the practice, maybe 3 months ago or 6 months ago, were they on a walker? Did they have a cane? Do all of a sudden now they have a cane to help walk through the door? Do they have, like I said, a brace on their leg? Have they gained? You can tell when your patient from the last time you saw them has just simply gained 30 to 40 pounds. We have to stop at some point and just look at them as a whole person, and just stop long enough to ask some good questions. And then they will tell you about the jaw pain or their facial tension and headaches that they keep hearing their jaw popping more than they've ever done before. Even the hygienist, as they're opening their mouths to start to clean their teeth, if they're seeing their jaw, deviate and pop, then ask them about that. Have a conversation, partner with them. They're going to tell you what's going on with them and if something has changed. Look at their medicines. It's all there, just sitting there for you to pay attention to. And of course, limited range of motion. We all have tried to do those fillings back on tooth number 18, and you can't even get them opened up enough to see what you're doing. I mean, heck, they're a candidate. And for me personally, as I do, a lot of cosmetic and full mouth rehab cases, my opportunity now to treat them with the TMJ before we even get started and after we have just seeded this whole new maybe bite is just really changing the way and the comfort of the comfort level of my patients.
Are you walking through the root cause of what's getting your patients to this pain? Are you walking them through what that journey looks like?
Absolutely. We not only now have the traditional dental little models in the practice that show the teeth and the cavity and how that's not good and the periodontal health and the bone loss, but we now actually have full head and neck models with the muscles and allow it to be there so that I can show them how, when they bite and how they close, that these are the muscles that we're having issues with, and this is what's causing the pain. Or here's the other one, the referred pain. It's the ones that they get referred to, like in the neck, in the back of the head, the ear, all kinds of places that they don't even consider that that's actually a TMJ problem.
Yeah, and it's important for everybody to know, because when so many of the practices that we've consulted with and worked with, it's easy to get the blinders on. And you know what you're sitting down with this patient, you know what they're here for, to not get into more of a wellness conversation. I'm a big believer in education of patients, because they want to understand. So much of our healthcare has been being talked down to, and we can actually hold their hand, educate, and be a partner in their journey. It's important, and helping them understand the root cause. So once we got that figured out, now it's actually the treatment. And this is important because, go ahead.
I'm sorry. I always have them point and push on the area that hurts, because sometimes they'll push right here and they'll say, my tooth hurts. We'll take an x-ray. The x-ray looks phenomenal. We'll take a cone beam, no infection whatsoever. But it's where some of these muscles actually are in spasm and where they have innervate, like actually attached to the bone, or possibly even right here underneath their eye, or possibly back here on their head. But when you push on it and really create that trigger spot, it will then show you where it's coming from. And it's not their teeth. Sometimes it's their muscles. This is a perfect therapy for that.
That's awesome. So can you walk us through how easy this is in your practice, how the setup works?
It's so easy for us as the professionals, but it's also, and this is what I keep hearing from my patients, just how simple the treatment was. Like that is the first thing that they tell me almost within 5 minutes of the treatment itself. So placing the grounding pad is honestly, guys, probably one of the worst things for the patients, because it's cold. Trying to figure out how to warm it up.
Yeah.
And the grounding pad's going to go on their back. It's pretty big, about this big. So if you're not careful, it's cold. And that's probably, we get to have a little laugh, but the grounding pad goes on the back, and that's just the way that the products work. You use a grounding pad for anything that is that we do with any of the applicators on EMFACE, but easy to do, easy to peel off when you get finished. We obviously clean the face. We don't want to put the applicators on a lot of makeup, or some people here in Plano like to wear a lot of makeup, and that's what we do in Texas. So we got to clean some of that off. But the good news is it's non-invasive, and they can go right back to work. They can go right back and put their makeup back on. So there's not a lot of downtime or anything like that. Finding the threshold for the patient is just simply standing there with them as you're turning the machine on, and allowing it to do its job, and just to be there and make sure that they're comfortable with the heat and the warmth of the heat that they're feeling, and the threshold level. A lot of them will, like you guys said, almost describe it as a tapping motion, but a comfortable tapping motion, not a contraction motion like we get more in the traditional EMFACE treatments. All of these treatments are 20 minutes. It goes by really, really fast. I have people say all the time, it's very much like a massage. They go, if I didn't know better, I could just close my eyes and meditate to the little beep of the machine, and I would fall asleep. That's how comfortable it is. And with 4 treatments, really comfortable, but they have relief almost instantaneously for most people.
Yeah, and we're seeing that as well, and it's completely hands-free once you get it set up, which is amazing, especially in a busy practice, because in a perfect world, you do the assessment, the education, hold their hands, walk them through, and then if you can have a hygienist set this up, or you set it up and you can walk away. As far as the business side of things, that's incredible. And Dr. Chandra and Dr. Wade, if you could please kind of dive into what's the general TMJ package that you're putting to your patients?
I guess I'll start. By the way, I have figured out a solution for the grounding pads. So first of all, it was actually the VTL team so you can definitely warm them up and rub them. Okay. But there's also towel warmers that you can actually put the grounding pads, those very, very low, the towel things that we give for cleansing. So if you put the grounding pad in there on a low temperature, like put it in there 10, 15 minutes before, and it's now working and they love it. So just a tip for anybody, we all do EMFACE aesthetic, now doing TMJ. So that seems to help with the grounding pad.
Yes, that's great. We actually keep all of ours in our server room on top of our servers.
Yeah, so it works, right?
They're nice and warm.
Nice and
anything you can do to
warm.
increase patient experience is good.
Yeah.
That's good.
It's a good. Anyway, so for the package for the TMJ, so I have been, when we did the pilot studies, I've been doing this for months now. So it's completely changed my routine of my protocol. I am completely doing the EMFACE TMJ before I even get the bite position that I need. So anybody that comes in, again, my practice is primarily TMD. So I get a lot of referrals from ENTs, MDs, and what have you, and people calling, and they're specifically calling for that. I also have enough of a general population with the patients, which Dr. Wade went over, Dr. Levine went over, that, how you have to talk to your patient about it. But it is part of my initial workup to let's get you hooked up to the EMFACE TMJ, and I do 4 of those. If I have an extreme patient, I sometimes even use lasers, but that alone, the TMJ EMFACE takes care of the immediateness and gets them a lot more comfortable. And then of course my whole protocol is after technology, finding out from the cone beam and finding out joint disease and whatever they need. Again, I have muscle EMGs and TENS units and tech scans and all of the technologies that we need to end up making for an orthotic, which is a removable lower orthotic that is programmed to help decompress the joints and help the muscles. But before all of this, EMFACE is it for me. And if my patient cannot do the orthotic, then we will just say, hey, let's at least do the EMFACE treatments. and do it a couple of times a week. And I'm finding tremendous amount of relief. I rarely write prescriptions. I have to have an extremely severe case. I tell my patients from the beginning that let's work this out naturally, because I'm very big into health and wellness and trying not to use too many drugs as a crutch. And that's also deters from the end product and the end result of what patients are looking to get. And, because it deters the outcome. And anyway, at the end of the day, I live and breathe it now.
Yeah.
And the problem is I don't have enough pads.
And I'm sure this has really affected your overall underlying
100%.
which
100%. Love it. Anyway.
and not having to use your hands, which is really
Yeah.
exciting.
And my girls are, by the way, cannot impress upon. I go in to see my patients just to literally say, how are you feeling today? Because it's so delegated. When my dental assistant, my receptionist runs my whole wellness center, which is down the hallway. And I rarely have to use my time. I'm with another patient, but I definitely check up on all my people. So that's the best part.
And talking about patient outcomes, Dr. Wade, could you kind of talk some of what you have seen? I think we have a video of one of your patients as well.
I did chiropractic work, and every 2 weeks we adjusted my TMJ. I'm not doing that now. I haven't had an adjustment for 2 months on it. So it's helped relieve the discomfort of that TMJ.
And then how are you feeling right now?
Great.
Immediately after your, oh yeah.
Yeah.
Look at that.
Uh-huh.
Nice opening.
What it does is it takes the pressure out of my ear.
Nice.
That's where I radiate my discomfort is into my ear. So it's almost instant for me.
For me, I don't really know how I get found as this TMJ expert in Dallas, because I certainly don't really advertise that much that I do it, but I guess the right things on the website and then our experience level and some of our patient testimonials help people find us who are in severe discomfort. And so when they come in, it's very nice to understand that you do have a toolbox and that you can present it as a package like we were talking about. And sometimes that's even with some class 5 fillings or things that have kind of popped out because they were clenching and grinding so much. So don't forget to add your traditional dentistry into your package as well as these new tools. So we do, I just wanted to talk about the sequence again, and this might be something the doctor can talk about as well, is using the most of your time. So you kind of come in with your limited plan, you do your diagnostic, you put together the package. But as I personally am designing or developing the NTI, I need to take it to the lab and do some work on it. So then we'll place the TMJ applicators on. They've got 20 minutes to do that. I'm finishing up in the lab, come back, take those applicators off, try in the appliance. Then secondarily, if we are going to do a neuromodulator injection, then we do the neuromodular injection. We can do the fillings beforehand or we can do the fillings after, just depending on your time frame that you have in the practice. So now you've made a package out of something that maybe a long time ago, the only tool you really had was to make some type of night guard or device.
And it sounds like it's not only businesses booming because of this, but it's also making the patient experience and the efficiency in your office better. That's
very well.
That's pretty amazing when you can hook somebody up to get almost instantaneous relief while we're waiting on diagnostic feedback to come back for the complete package. That's exciting.
Yeah, absolutely. And just to let people know, the great thing about the device is that it is very mobile. So I can easily move it to another room, just with like a lot of technology and devices that we have in dentistry. So that the flexibility of being able to move it from room to room also helps, I think, use it more often in more rooms and at more times. And hey, if you've got a little extra time in hygiene and somebody's complaining that they're sore just from opening up from getting their teeth clean, then allow them the beautiful, advantage of getting to try out, EMFACE TMJ.
Yes.
So that's, I guess what I'm saying is it's the relief after the treatments. If I have somebody who was already tight before we did maybe a posterior crown, then we will allow them to have the opportunity to have a TMJ treatment after their crown prep, so that they do go home and they're very, very comfortable. So this improvement, not only from the traditional dentistry that we're doing, but also, for those who actually have been, really debilitated from maybe a longer term TMJ or TMD dysfunction, their improvement in the quality of life is huge. Their headaches decrease. I hear a feeling of less pressure, more relaxed jaw, how they hold it. And I think that might be part of what the video testimonial says. So I don't want to repeat what maybe.
I really want to get to some of the functional stuff, some of how the facial aging and the muscle breakdown really can affect what's happening both in facial balance and function. We do a lot of EMFACE. We're top 10 globally for EMFACE provider on the aesthetic side. So we do quite a few treatments on this. And I'm a big believer in treating from the base and the function and the foundation first out. So we engage that muscle, we engage that connective tissue to really bring some amazing results in a conversation with our patients that they've never had before. Kind of to echo what you were saying, Dr. Wade, is we are trying to take a look and educate the patient of the entire picture of what's happening. Because everything that we've talked about in facial aging has been collagen, right? And don't get me wrong, we don't want to ignore that, right? We want to address the collagen. We lose 1% every year after age 22 for the rest of our lives. But what our patients haven't heard about, and a lot of us haven't either, is we're also losing up to 8% of our facial muscle tissue. And when we lose that structure and that foundation, not only is it a loss of volume, but also function, our connective tissue, right? Our SMAS, which wants to be nice and right and tight, really starts to become lax and hang down. So on the aesthetic side, when I'm sitting down and doing a consult, I draw out the dermis, I do the full education breakdown, and I'm going to let Dr. Levine do a better deep dive in this. But it all plays into the wellness conversation that we're having, is take a look at the whole picture of what we need to address. And the aesthetic side, the structure and the foundation is a piece of that. So if Dr. Levine, you could kind of dive in to how the facial aging disrupts some of that facial balance and function.
Yeah, it's such an interesting conversation that we're having. So, it's very interesting. I got involved with something called lip sync that I work with a plastic surgeon. That's a surgical approach that led me down the road of understanding facial aesthetics. And, we own the dental world. We basically own the real estate of the lower third of the face because we have this lower jaw that has something called the vertical dimension. We have an upper lip, and we say the lip rules when it comes to aesthetics. Well, an interesting thing happens from 30 to 40 to 50. Every 10 years, our upper lip drops 1 millimeter. And one of the things I've done in dentistry, starting almost 25, 30 years ago, was to develop this aesthetic evaluation form. And when we look at aesthetics, we look at things from a face standpoint, a lip and teeth standpoint, dentofacial, and then dental. And very interestingly, when you diagnose, you can see from the age of the patient how much of that tooth is showing. So when you think about aesthetics, right, and we say aesthetics and function are two sides of the same coin, and when we look at those aesthetics, if we can bring the facial, the upper lip and the facial structures upwards, and this is showing the thirds of the face and the muscles, and then so if you got zygomaticus, major, minor, and risorius, and you're moving things up, well, there's the non-surgical approach, because we do a lot of modeling 3D. We do something called RayFace, where we're able to create a digital twin. We're very kind of this digital workflow with our team, but we diagnose very clearly because we want to know, how much has that upper lip drop, and we measure. And so if you look at this kind of lower third area, here's a new tool that allows us non-surgically to move things upwards and to get ahead of the aging process, which is extremely exciting, because you said something that's so critically important, which is we talk about tonicity of the skin and collagen and all that. It's critically important, but the underlying structure of the muscles and the tone of those muscles is also going to have a tremendous impact. And so if we start early enough with these non-surgical approaches that are very conservative in nature, we can get ahead a lot of the aging situation as we go onwards in our wonderful years of 10-decade jumps. And so if you look at this facial balance picture, you can see that what people are faced with is sagging of the areas around this lower third of the face. So from a smiling perspective, some people have a high smile, high and wide, beautiful smiles. Some people have more of a low and moderate one. And as we age, we really start missing out on the smile, because, we say the lips, it's like the curtain on a stage. When the lips go up, it's showtime, right? And what's behind those lips? And all of us in aesthetic reconstructive dentistry work so hard at beautiful tooth form, but it's also the composition of the face. And you really want to get back, show the edge of the tooth. So from a clinician standpoint, here's a tool that allows us non-surgically to take the lip and the facial structures and go upwards, bringing it back to the way it was non-surgically, because we can do that surgically with lifts and different plastic surgical procedures. We go early enough with this, and if we do it with rhythmic, kind of this almost a maintenance protocol also, we're really going to get ahead of a lot of the facial aging that we see.
Yeah, and I love the way you said that, because I talk to a lot of dentists, and I work with a lot of dentists, and they're selling smiles a lot of the time when all they're doing is teeth.
Yeah.
And what we're really trying to accomplish, or what you're really trying to accomplish, is truly restore the smile. And
exactly.
You said that beautifully, where now we can actually start to show the teeth off that you've worked so hard to perfect, or get as close to perfection as possible, and allow the face to smile again. And so many people, when they have teeth that bother them, they don't smile. So they actually get a faster breakdown of atrophy than a lot of just normal patients. So when we can now have a solution, that's amazing. That's a huge.
And I would add one thing about this. If we're not putting the soft tissue kind of back to some of the original place, and now we have a non-surgical approach, there's a tendency for the aesthetic reconstructive dentist and the aesthetic dentist, the cosmetic dentist, to make teeth that are too big, and it doesn't fit the face. And we see that a lot. Central incisors, we're all in this world, we know it's 10 to 11 millimeters. All of a sudden you got high smile line and you're showing these big long teeth. It is actually, very unnatural. So here we have a tool that allows us to address the soft tissue area, not just the hard tissue. So from a facial and a dental facial standpoint, the diagnosis is critically important. Then we visualize where we want to go. It's a critical way of our methodical approach of diagnostics. But now we have this tool, non-surgically, to really help our patients rejuvenate that soft tissue, in addition to the things that we do on the tooth level that also does have a scaffolding effect. And that works nicely together to create ideal facial aesthetics for our patients.
I love that. And what are you seeing as the growth opportunity in this space for somebody that owns their own practice? How does this really look forward in terms of trajectory?
It's everything everybody's talking about. We have this new additional tool in our toolbox that we're talking about here. And what happens, what Dr. Chandra is talking about, and I personally have just learned something, and we learn from each other. And I love what she was talking about, that, from a neuromuscular standpoint, just talk about the TMJ side. If you start with this, you're going to relax the jaws, and by the way, we have done this in dentistry for years. We just didn't have this tool. We did it with deprogrammers. We did it with, appliances. It took weeks and weeks and months to relax the musculature of TMJ, TMD problems. TMJ is when we have more of an internal derangement, and TMD we're normally talking more muscular. And it takes a very long time. And so now we have a tool that works much faster. So to start with it is such an improvement for our diagnostics, because as we take records, jaw records, because we deal with a lot of reconstructive dentistry, to relax the muscles allows us to take something that we call reproducibility in our records, because usually we can't start with records until we relax the muscles. So the advantage is that we have a new tool that people will love. We have a tool that will help our diagnosis and our treatment planning. And then along the way, even patients who have just some of this jaw tension, now you have a tool to add to, our bag of tricks, our therapeutics, to relax the jaw. We're seeing it. If you read, I look at the reviews that we get from our Smile House, and I'm like smiling from it, because the number one thing people talk about is the stress release jaw massage from an esthetician that we have. And to me, we work so hard on all these other things, and that's what so many are talking about. But it's really interesting because so many people keep their stress in their jaws, so the aesthetic side of EMFACE is very excited. And this new TMJ protocol will absolutely need to be integrated into our diagnosis, but also into our treatment planning. Somebody has TMJ and TMD, that now becomes one part of our protocol. That, in addition to maybe it's a mandibular advancement device because it's a sleep patient, maybe it's an orthotic because they're clenching and grinding because of stress, and mostly, a lot of stress. And then we do deal with, all these things around meditation and mindset. But, it's what we are all talking about is a very holistic overall approach to both our diagnostics and our therapeutics. And here's a new tool that's going to allow us to do that.
Yeah. And that's what patients want, right? They want to have a conversation about the whole picture and what you can do. Oh, and by the way, we can also help you look better. Your nasolabial folding, some of your jowling, getting into the under eye bags, which has just been a huge boon for our business, because to treat under eye bags in the aesthetics world has either been super sketchy injections, which we won't be a part of in our clinic, or you're looking at a lower bleph. And now we actually have a foundational and structural solution to get that. It's a natural conversation when you're already using the device on somebody's face to talk about what else it can do from your staff. You're expanding your service offerings when it's easy to delegate. Literally anybody in your office can effectively set this up on a patient and treat. So you have something that's delegatable. And when we do our consulting and our coaching, we always stress you have to invest in something delegatable. If you're going to buy something that's going to require your hands to be in the mouth again, we're defeating the purpose of expanding and diversification of your business and also what you can offer to patients. So the delegation, the hands-free is amazing. And all of us can 100% say that we've seen this 91% patient satisfaction rate. That is real and does not we don't get to have these type of efficacy conversations with many things that we bring into the clinic. And when you have something that you get your hands out of the way and see these type of results, it's truly amazing. And it's part of the entire BTL platform. And I have every single one of these machines. We do very well with every single one of these machines. But when you can invest intelligently in something that's a natural progression for the next steps of your patient, both in your discipline, but then also getting into aesthetics is very, very exciting. I want to thank Dr. Wade, Dr. Levine, Dr. Chandra. This has been amazing. Great. I learned quite a bit on this call. I love doing these webinars because I always learn, and I love how holistic and more of that functional health side we're all thinking. So I want to thank you all. I think this has been extremely beneficial, and educational and hopefully eye-opening to really how amazing this technology is, how it fits into so many patients' lives and how we can change it in the wellness side of things. But then also now you have arguably the greatest structural aesthetic device ever made, without question, which is very exciting. So I want to thank all the speakers and guests. Thank you, thank you, thank you. You make this easy. And thank you to everybody that tuned in. But EMFACE TMJ,